Okay, we're going.
Thank you. Good evening, everybody. This is a meeting of the Neighbourhood and Public Spaces Committee of Basildon Council. This is a meeting of the council which is being held remotely. The meeting is being recorded and streamed via YouTube, where members of the public are able to watch the meeting. The recording will be made available on the council website following the meeting. Please note that any comments posted on the chat feed of the council's YouTube page during the recording of this meeting will not be monitored by the council. Thank you very much. Apologies for absence.
We've got Councillor Burton Sampson here replacing Councillor this evening.
Okay, thank you. Declarations of interest. Councillor Buckley.
Sorry, it takes me a long while to find the unmute button. Just to declare non-pecuniary interest in item 8, the youth zone. As a county member, we also are responsible for youth services.
Thank you, Malcolm. Item 3, the minutes of the meeting held on the 23rd of September on pages 5 to 14 of the agenda. Councillor Buckley.
Yeah, thank you, Chairman. I just wanted to make a point on minute 604, which is on page 3 of the minutes. Just to thank you, because when we had the last meeting, there was going to be a charge put on for short-term parking, which I highlighted I didn't like. And just to acknowledge, I'm grateful for you keeping me in the picture and for the change that we've made, which I think is the right decision to make with the 3 hours parking. One minor comment I would make, and a couple of people have said to me, I'm only staying 4 hours, do I only need to pay for an hour? We could do with some clarity on the notice.
Yeah. Malcolm, can we pick that up on the car parking on the COVID impact assessment, because there's an item on there which covers this.
Okay.
So if everyone's happy, well, let's run through. We need to vote whether or not we're in favour of the minutes. I'm in favour of the minutes. Councillor Blake.
Abstain, I wasn't there. Well, I was there, but I had no voting right.
Councillor Burton Sampson, abstaining.
Abstain.
Councillor Buckley.
In favour.
Councillor Ferguson.
In favour, Mr. Chairman.
Councillor Holliman.
For.
Thank you. Okie dokie. Item 4 is the work programme on pages 15 to 17. I would like to add one to the work programme with no particular date, but at some time this committee is going to be called to make a response to the planning application from the county council, not by the county council, to the county council by Clearaway for their waste recycling plant in Pitsea. So that needs to go on as an item because we will need to respond to that application when it is validated. Malcolm.
Yeah, thank you, Chairman. Wasn't actually on that, although I agree that a response should come from Basildon and be very clear about its aims and objectives. I think we're all on the same page on that particular item. I just wanted to mention the last item on the current work programme is about street naming and numbering policy. And I do recall having discussions with officers in the past about that. And in particular in your ward, I did not think naming the streets after Scottish plans was particularly appropriate for Wickford. Given that there is an awful lot of building planned for the area, whether we like it or not, I think we ought to raise the priority of that, because it is clearly something where people like or don't like names, and to have them all named after a topic with no relevance to the borough, I think is a bit sad if we have to go down that line.
Thank you, but I think the policy is being worked on at the moment, and in effect we're leading up to March, so that is likely to be on the first or upcoming in the agendas on the new municipal year, Malcolm. So it's not way in the future.
No, that's fine. As I say, it's just I was minded of some of the schemes that have been talked about, and you know, I don't really want to see them.
No, I agree. I think the policy needs updating, and we will do that.
Yeah.
I'm sure.
And I think the other thing perhaps we need to look at as part of that is who is authorised to decide on the topic. It used to be members, then it went to officers. I don't know if it's come back under.
Well, we'll wait to see the policy, and we can always change it if we don't like it, can't we? Or attempt to, at least. Okay. On the work programme. Anybody else on the work programme? No. Okay. I vote in favour of the work programme as it stands. Councillor Blake.
In favour.
Councillor Burton Sampson.
In favour.
Councillor Buckley.
Saying it's your work programme, not mine.
Councillor Hollyman.
For.
Councillor Ferguson.
Favour.
Thank you. That's carried. Thank you very much. Now we move on to a very important item on the agenda: healthcare provision in the Basildon Borough. And tonight we're very fortunate to have with us Kerry Harding. And I'm not sure, Kerry, what your title is these days, but you can tell us in a moment. And William Guy from the CCG. So I don't know, Matt, do you want to start the ball rolling? Or
yeah.
Do you want to throw Kerry and William straight under the bus?
No, Chairman, we'll be doing a joint tag.
Okay. Right, who's going to do it, Matt or Tomasz?
I'll be introducing it, Chairman, and there'll be contributions from our guests from the NHS, Kerry and William, together with Matt.
Okay, thank you, Tomasz.
Okay, so thank you, Matt, for putting this. I take it all members can see that on screen. So this is just a quick overview of the health programme. We're delighted to have Kerry Harding here with us this evening, Director of Estates and the Clinical Commissioning Group in Mid and South Essex, together with William Guy, who's the NHS Alliance Director for Basildon and Brentwood. They'll be providing a little bit of context within the presentation to give members an appreciation of the areas and the significance of their operations. Next slide, please, Matt. So members will be aware, and in this presentation we'll reveal further the various partnership working projects that we've attained to date in collaboration with our colleagues within the NHS and CCG. And members will probably be aware as well of a number of such projects and operations, such as the Regen strategy. Recently in Basildon Town Centre, we engaged with key stakeholders such as the NHS and CCG back in January, and they kindly participated throughout the whole consultation process through webinars, etc., leading through to the attainment and establishment of that strategy. What members will see going forward within this presentation, primarily through Matt, is the range of projects that we have been operating with them. So I'll just pass that over now to colleagues who will give you a little bit more of an appreciation. So if I can pass to Kerry and William, who will give you a little bit more detail, Chair.
Thank you. Thank you, Tomasz.
Cool. I will kick off. It's William. Apologies, I'm not sure my video is working. Hopefully you can at least hear me. I think I've spoken to this group before around the kind of complexities of the NHS environment, and this slide attempts to encapsulate the world in which we're currently working. So for most people, I think the NHS is the organisation that delivers health care to the population of the UK. It's not until you're working within it, I think you realise quite how complex a structure it is and how many organisations involved in delivering different aspects of care, and even on a footing such as the Basildon Council area, how many different agencies are involved in the delivery of care and kind of complex decisions that need to be taken because of that. And we'll just touch on some of the key stakeholders in the next couple of slides to kind of set some of that context. So we can move on to the next slide, please. So firstly, NHS England. So But Basildon and Brentwood CCG at the moment isn't delegated for primary care, and so the key role NHS England plays for us is around the provision of primary care services. Whilst we work very closely with primary care, for our CCG, actually NHS England is their commissioner. We are accountable to NHS England, and therefore have to work with them on strategic issues and estates issues, and I'm sure in a moment Kerry will touch upon some of those. If we move through to the next slide, please. Thank you. We're obviously Basildon and Brentwood Clinical Commissioning Group. I think I know many people in this group. We've been established since April 2013 and cover the two boroughs of Basildon and Brentwood, about 280,000 people as part of that, covering a broad range of health services from a commissioning perspective. So we commission children's acute services, mental health services, community services, some of the third sector involvement within that. But the broad part of the NHS that people access, with the exception of general practice and dental services and pharmacy, we are responsible for. If we move on one more slide. So the other kind of constant thing within the NHS is change, and we do like to kind of rebrand, restructure ourselves on a very regular basis, and that happens to our hospital trusts as well. And so probably most people are aware that Basildon and Thurrock University Trust, which used to be an organisation in its own right, is now part of the Mid and South Essex Hospitals group. So alongside Broomfield and Southend, operating as a single entity now that covers the whole of Mid and South Essex, and beyond. That actually there are services that each of those sites deliver that service the whole Essex population and more so. So for instance, at Broomfield, there's the plastics and burns service that services not only Essex, but parts of East of England and parts of North East London. There's obviously a number of other sites that they're responsible for, so they're listed there. The closest one for us is obviously Orsett Hospital. We move on another slide. We're going to be touching upon some developments with the East of England Ambulance Trust. So probably this is the biggest provider that we'll touch upon this evening. As their name suggests, they cover the entire East of England region through a very complex network of local operational units that end up all over the county and all over the region, depending on what demands are at the time. They obviously have to make decisions that meet the interests of the whole of the East of England when they're looking at new estate, new arrangements, etc., and have to make their decisions within that context. We're relatively fortunate in Basildon and Brentwood that is our remit. For them, they've got to make decisions across a much broader, more complex footprint of some very, very rural areas in Norfolk and Cambridge, and some very, very densely populated areas here in Essex and the other home counties. We move on. I think, again, I've kind of touched upon this before with several people, but it's worth just kind of refreshing where we're at with primary care networks. So they're a relatively new entity. So in 2019, they came into force across the whole of England. There is now a number of primary care networks in operation. These networks bring together practices to collaborate. That's effectively why they exist, on the basis that we feel nationally and locally that the effective provision of primary care, whilst underpinned by independent practices continue to deliver, can only really survive and thrive if there is some element of collaboration. So practices need to work together to ensure that there's a consistent offer delivered to their population, but also to collaborate on new roles and new ways of working that you can't do on a footing the size of a single practice. You need to do a broader scale, and so this was the central initiative to try to progress that collaboration across groups of practices. Within Basildon and Brentwood CCG, we obviously have the 6 primary care networks that are detailed on this slide. 3 quite neatly sitting below the A127, and then obviously for Basildon Council, then Wickford and Billericay. They are deliberately geographically coterminous. I know that the mixture of what's happening beneath the A127 does look a bit odd, but they're deliberately set up to try to be geographically coterminous on the basis that certain services that you need to deliver can only be done on that basis. You can only make efficient use of a workforce if they're working within a reasonably small area. Primary care networks are very much still finding their feet in terms of what they're trying to do, what they want to achieve, and where they're ultimately heading. And it's been led by a series of central initiatives that are focused on particular things. So for instance, at the moment, the care of people in nursing homes and how practices collaborate to better support care homes is a key area of focus. There is significant new investment going into primary care networks nationally, and we're benefiting from that. A lot of that investment is associated with new roles in primary care. So I've listed some roles on this slide that you wouldn't traditionally see in your GP practice. If you were to go and see your GP, you're probably likely to see a GP, a practice nurse, and maybe a healthcare assistant. There are some examples of other roles that have existed, but it tends to be the exception rather than the norm. The workforce pressures facing primary care nationally mean that we can't continue to rely on that traditional model for meeting the demands upon primary care today and going forwards, and therefore we're trying to support these new roles to develop and evolve in a primary care setting. And I'm very pleased to say that we've managed to start that recruitment process, or our practice have managed to start that recruitment process, particularly focusing on this at this point on pharmacists and social prescribers. But a lot of them are starting to explore the other opportunities that are available. And this workforce will operate on behalf of that whole primary care network, not just an individual practice within it. It will be something that the entire population can access. And actually, leading on to what this means from a premises perspective, it will mean that we'll need to start accommodating some services that will be open to all patients from Billericay, for instance, but in a single place. And there are a significant increase in headcount coming with the funding that's associated with these new roles, and all of those services will need to be delivered from somewhere. Some offer some elements of remote working, but they will also need physical space as well. And one of the things we're working through with the primary care networks is how would they accommodate these services effectively and efficiently. As I say, the kind of underlying context of that is that we are moving to a model of primary care being GP-led rather than GP-delivered. So I think most people's expectation when they go to their practice now is that they ideally want to see their GP. People are probably more open to seeing their practice nurse as well, but actually some of these roles aren't commonplace within practice, and so there's a communications exercise that we need to work on, and a potential change to the public expectation about who they might see if they approach primary care. I'm confident that when these roles come into place and are established, people will utilize them and like being able to access them and see the value in them, but that will take a while. If we move to the next slide, please. So Kerry and I will double team on this slide. So it goes without saying that the NHS has been significantly affected by COVID in the last 8 months, and will continue to be so for a period. And that's affected the delivery of all services across the NHS. I think it's probably fair to say that there's probably no service that's been untouched by COVID in some way. Back in March and April time, at the initial pandemic taking place, we focused all of our resources on tackling the pandemic and ultimately stopping the NHS from being overwhelmed was the key message that guided us through that period. I think probably what we've learned in the last 3 to 4 months is actually the recovery process and running business as usual alongside COVID response and business as usual in a COVID world where there's so many restrictions about what you can and can't do and how you have to operate is actually probably more complex than the initial task that we faced back in March and April. What we have seen across the NHS, and particularly in primary care, is a shift to telephone triage as being a kind of first port of call in accessing services. So there's an awful lot of work now done non-face-to-face by primary care. That's had a mixed reception. I think in some situations it's worked well. I think an awful lot of people are used to seeing somebody, used to visiting the practice, etc., and having a telephone call isn't necessarily what they were expecting. All of our practices have continued to operate a face-to-face level of provision throughout this period. We've not had any practices that have been closed for any period because of COVID outbreaks or anything similar. We've also introduced video consultation technology across all practices that kind of supplements the face-to-face work that happens. We're trying to do a very concerted piece of work now around how we make sure that those most vulnerable who don't necessarily have access to digital technologies can still access a good range of services. And ultimately, I think we're going to be in a position whereby when we do come out of the COVID incident, we're unlikely to retrench back to where we were in terms of that very face-to-face dominated way of working. There was always an underlying digital agenda that the NHS has in terms of the use of alternative technologies, etc., to deliver services. We've rushed through the implementation of that because of the COVID challenges, but I don't think we will revert back, as I say, to where we were. We need to strike the right balance. We need to recognise actually there is a really important face-to-face role that needs to be played. We need to make sure that with those interfaces that we've got where they're not done on a face-to-face basis, we're still taking that responsibility around public health and kind of the wider impacts of health that primary care is so important at trying to address, and things like safeguarding really importantly, because it's a different model of delivery. So there's a lot of work that we've still got to take forward on that front, but that's been the shift over the last 8 months, and obviously that has an impact on premises. Kerry, did you want to come in at this point and talk through the work you've been doing on this front?
Yeah, sure, absolutely. Thanks, William. So it's obviously been a very, very busy time for a stage during the COVID response. And as William says, we're also now looking at reset and recovery. We are a very small team. So as I said in the slides here, although we haven't ceased any projects that we've got live at the moment, progress may have been a little bit slower than we'd expected or wanted, because as I say, there is only so much we can do at this time.
Can I just ask here, Kerry? It sounds a bit quiet for me. It might just be me.
Okay, it might be too far away. I'll try and shout. I don't normally have a David, as you know, is that better? So, it was just to reiterate that, as I say, although we have been extremely busy, there's obviously we've had the initial COVID response. We're now looking at winter planning, and we've also got reset and recovery work, as I alluded to earlier. But we haven't actually stopped work on any of our business as usual projects. So, although progress may have been a little bit slower than it would have been in normal times, rest assured we haven't actually stopped work on any of those projects. I just wanted to make sure that everybody's aware of that. Also, just as a result of the COVID response and the work that we've been doing, we are actually reviewing all of the current projects just to ensure that we're absolutely maximising the sustainability of those buildings, that they actually meet our requirements as we go forward in terms of dealing with a future pandemic or other issues, and that buildings now are completely flexible. We have considered and will continue to consider the digital impact. That was already on the radar, as William has said. We've just brought things forward slightly earlier. It doesn't necessarily mean that our buildings will be smaller. They just might look slightly different to they would before. So I think some examples, as I put on here, is that virtual consulting spaces would have generally, our thoughts before would have been to put them in staff areas so they're nice and quiet. But actually, with the opportunity to bring forward more virtual consulting and outpatient consulting, we'll likely put those in patient areas so they can be shared sites. So we've actually got some good learning from COVID. I think the other thing that's been really good is that having to deal with this so quickly, it's really strengthened our relationships and our coordination of projects across the whole of the system. So again, it's escalated the work we were doing. So we've made some good progress in some difficult times. Next slide.
I'll pick up at this point if that's all right, and Kerry, do jump in on any of these projects if you've got any additional things to add to it. But I just thought I'd just run through a few of the projects that we've either recently worked on or are working on at the moment. This one, you'll know, Market House in Wickford. So the construction of a new surgery was completed in July 2017. So this is just an example of a council-led project. So facilities with 8 consultation and examination rooms, 2 treatment rooms, training and meeting rooms, staff facilities and parking. And that's occupied by the London Road Surgery, who have a 25-year lease with the council. So that's one that we have done. One that we're helping support our partners Swan on is the Langdon Centre. So this will be a new significant new centre. Swan are working with Assura as their preferred partner to deliver the new facility. It's part of their wider Langdon Centre regeneration. Works on site on the wider project have been hampered by COVID. They were off site during the summer, but they are back now. And the planning consent and works are due on the health centre are due to start late 2020. So designs are currently being finalised between Swan, the CCG and the GPs, and myself and Kerry have been in a fair few meetings in relation to that recently. So completion is anticipated 2021/2. I thought I'd just put this one in, which is the hospital work. So planning permission was granted for a redesigned entrance to include segregation of emergency vehicles from pedestrians. And with an aim to provide a gateway entrance that improve patient and visitor experience. However, as you may know, the scheme is on hold whilst Basildon Hospital review the viability and the requirements for that. I wonder, it might pick up on the point that Kerry was talking about in relation to planning, spatial planning after COVID. Actually, I wonder if that might impact on some of these plans. But I think what we wanted to say from the council's point of view, we're still holding discussions with the trust and we're making sure that they understand that we're still there. Should this become a viable concern, the team will be ready to work with all parties to facilitate. So we're keeping a watching brief on that. We're letting our colleagues know that we're ready to move forward with that should that be viable. Just a few other issues in relation to the hospital trust. So quite recently, we've assisted the trust to acquire space in the town centre for phlebotomy services. So there's a temporary facility in the town centre which is due to open in early 2021. We're talking to them at the moment about more permanent solutions as part of the overall town centre regeneration strategy. Also, we've been talking about opportunities for the delivery of housing units for students and staff. So that's we've been liaising with our colleagues in the D&I Development Investment Team and Sempra Homes as well, where there might be linkages with the work they're doing with key workers. So that's ongoing at the moment, and also we're reviewing. Again, we're also reviewing other site opportunities within the town centre for further non-acute services such as scanning and testing. Thomas, did you want to say anything on this one?
Yes, thank you, Matt. Just briefly, members, you'd be aware from P&R committee last almost 2 weeks now, 21st of October. This was reported. in many respects, it's a positive in respect of COVID, if there could be such a thing, in the sense of there is an opportunity here for us to support partnership working with our colleagues in the NHS. And it was agreed in principle to progress this site for a new ambulance hub. And there's an image there on the screen that members will be able to see. And some members may be aware of an example of one in Chelmsford in particular. The whole idea behind this is to be a new hub servicing around about 18 ambulances, all their crew, cleaning and the support. And it would provide greater, more rapid call out in respect of the current COVID-19 outbreak. We're currently engaged with the process. We're progressing with heads of terms in respect of that. We'll finish off the design, which will then go to planning with highway input from Essex County. And as previously reported, there are other elements regarding releasing the restricted covenant, which we'll be progressing as well. But this is a positive example, members, of how we've been working very well with our NHS colleagues, and a real positive addition if it is able to be finalised and be brought forward. So just wanted to share that good news with you.
Just to quickly move on to some other opportunities, these are ones that are more early, feasibility kind of work. So the first one to just flag up is the Gora Knights Ballards practices and into the sporting village. So you probably know this, but St Nicholas Mews has previously identified to provide a new GP surgery. The funding constraints and the building design not having the capacity to deliver the extended range of health services required meant that that plan was shelved and the night surgery since closed. But what we can say is that officers in my team are currently working with the CCG to explore the potential for a new consolidated service on some specific sites near to the town centre. So very, very early feasibility work being undertaken at the moment, though there are early discussions, but obviously the timing is really good in terms of this, because a lot is happening, there's a lot of change in the town centre, there's a lot of activity and new partners that are coming into the town centre delivering mixed use opportunities. So this is this gives a really good time to look at that again in a bit more detail. Just moving on to Wickford, just to say Swanwood's practice, again, you probably already know, previous study was undertaken to consider options to bring forward a health-led scheme in partnership with the council and NHS. Again, this struggled in terms of the financial viability. Further work is required with the local GP practices to develop and review wider options and opportunities for Wickford. But what we have recently started as a council and the CCG is looking for potential opportunities for phlebotomy. And that is again in alignment with the council's current asset review work. The council are doing sort of a number of feasibility projects within Wickford at the moment, and we're kind of working with our colleagues there to see if there's opportunities for alignment. Then the final point is Pitsea. I don't know if you wanted to mention that, Kerry.
No problem at all. So this project has been in the pipeline for some time now. We did have a draft outline business case that was submitted and reviewed. It's still in development, it's still being worked through. One of the key elements of that business case is to ensure that the estate and what we deliver supports the future models of care and also the ambitions and the objectives of the practices involved. That also now includes that wider primary care network and ensuring we can make the best use of that space and delivering the best range of services for the local community. So we are making progress on that. I think, as I've mentioned with all of our projects now, we are looking much wider than we have in the past at just a GP practice, and how they want to act sustainably is actually looking at the system and how our developments can actually help across the system to bring services closer to where people live and to make much better use and much better value for money with all of our buildings that we have.
Brilliant. So just to conclude then, next steps. So obviously progressing the current projects, deliver improvements of health provisions for residents. You've seen some interesting things that we're working on at the moment. The ambulance hub supporting Swan in terms of the Langdon Centre.
Second point is the adoption of the Basildon Town Centre Regen strategy has provided an opportunity to engage with various providers regarding potential healthcare development sites. So this is a real moment in time where we can look at what we do in the town centre in a really accessible spot, and we want to make the most of that, and that's what we're trying to do now. And obviously our colleagues Kerry and William were involved in the regen strategy in that process, and they were part of that feedback sessions that we had during the process. So officers will continue to work with colleagues at the CCG, NHS England, Hospital Trust and Ambulance Service to bring forward various healthcare regeneration projects across the borough. As we've seen, it's not always easy. There's a number of constraints that we're all having to work to, but I think it's keeping the communications lines open, and all of our partners knowing that the council are ready to engage. So thanks.
Thank you, Matt.
I'll stop sharing my screen.
Yes, please, so we can see who's here. Right, let me come in first of all and thank William and Kerry for the presentation together with Tomasz and Matt. Excuse me. On the overall picture, that's interesting to have all that knowledge and to be made public. On the question of the primary care network, I think that's is a way forward, but we need to have some evidence of the time scale of that and how it's going to affect the people. I'm pleased to see thing on the ambulances, etc., and what is making progress in the centre of Basildon, but I'm disappointed that what I consider the important ones as well are left to the other opportunities, you see, because I've had, and I know other members have had, people on about the question of nights being closed, the problems in the Gora, the problems in Wickford. And I'll deal with Wickford first of all, because I met Kerry and other people over 4 years ago, and we came up with an option for Wickford for the existing old health centre, which everyone admitted was in a similar state to what the former London Road surgery was and needed improvement. We came up with a scheme and an option with the council. Now today, that is the first time I have seen anybody say it's not financially viable. I've asked about this, and that's the first time I've heard that, and I'm disappointed, to say the least. I'm pretty certain other members will be disappointed that Knights is closed, and I don't think the Sporting Village is an option. The question of the Gora, I know Councillor Burton Sampson, and I was involved in that as well with him when I was mayor, when people started complaining about what was going on at the Gora. Pitsea, yes, the Dibble Centre is going to be improved, but I think we might, I saw Councillor Ferguson, we'll be looking for a date. Billericay doesn't get a mention. No one has told me there's a problem in Billericay. I don't know if there is, but I'm talking about across the borough now, and it seems to me that by concentrating first of all on Basildon Town Centre and putting everything into the town centre, you've got to look at walking distances for people as well, and the roads they have to cross, etc. From like Lee Chapel North, from Councillor Burton Sampson's ward in St Martin's, etc. But I would have liked to have heard more on those things. Okay, I'll throw it open. I'm waiting to see a hand go up. I hope I haven't killed the Councillor Burton Sampson, then Councillor Buckley, and Councillor Holliman.
I'm happy to give way to the other two councillors. They had their hands up in participants before me. If not, I'll go first. Either or.
All right, I'll call Councillor Buckley then.
Thank you. I'll go afterwards.
Chairman, I think Councillor Holliman was the first to put his
hand. It is where you appear on my screen.
Yeah, yeah, we'd all put the blue hands up, but never mind, that's by the by, as long as we're all on the list. I think within that presentation, there are a number of good points, and like you raised, Chairman, I think a number of issues as well. I am very concerned, as you rightly say, about the Swanwood Partnership. I happen to be a patient, so I suppose I need to declare that as a general interest. But certainly when that site was being looked at whilst we were in administration, personally, I actually wanted it to move across the road to where the community centre was, but that's gone now for whatever reasons. Then we talked about this being a site, not that was non-viable financially, but that was impractical to develop and maintain the services in the existing practice while you redeveloped it, took down the block of flats, the power station, etc., etc. But I'm irritated that it's taken so long to come up with a reason not to do it. And I just say, I was actively involved with the relocation of London Road surgery. And I think that took us something like 4 years from conception to the place being actually open and serving patients. So one of my points I wanted to make was the new structure. The finger always used to be pointed at estates for being the problem, and it's always been a nightmare to get answers from estates. So I'm sorry to the representative of the estates department on here, but they were a nightmare to deal with. Even when it came to the night surgery, when the development took place across the road from there, we did offer a facility but nobody ever came back and said, no, it's not the right design or anything, because straight away we throw these to the NHS, who actually designed the London Road building. We built it, we rent it out to them, and it works. As far as I know, I'm not a patient there. But I have also got a number of other points. There's talk about the cluster of hospitals. And as far as I know, Southend takes the bulk of cancer patients, for example, but Colchester historically has also taken some. Have we disregarded the links with Colchester if out of area patients are coming into our practices? I've no issue with sharing the facilities, but you know, let's know what we can do. There was talk about using other providers. I often see a practice nurse, and I find because she specialises, she probably knows more than the doctor in reality about her speciality. Maybe not, but I think she does. But I also regularly talk to the pharmacist. In the past, I've often had flu jabs and the like through the pharmacist. And I think there is a lack of awareness in the public about the services that can be accessed through different sources without going through the process of going to the GP first. What we do need, though, is to be sure that those alternative providers have got sufficient knowledge to know when they don't know the answer and to refer to a more specialised practitioner. I have some concern. You talked about specialities in the town centre. I do have concern about access, and the chairman rightly mentioned that, not just pedestrians within the town centre, but access to those facilities, as we have a challenge to get, for example, to Basildon Hospital from Wickford and Billericay now. If you don't have a car, it's an awkward journey. Yes, you can get a bus, but it's not a very easy journey. There are the mention of total telephone triage. I actually agree with that as a concept of directing people to the right specialist in the first place. And it's something I've gone through a number of times recently. And I've found it works, and it's satisfactory. The doctor knew when to call me in to do the tests that they needed. So I think that's fine. But I'd like to know, is that now a national direction, or is it one that's just localised on this area and our CCGs? The ambulance hub also gives me some concerns. I don't particularly have a problem with an ambulance hub there per se, but again, going back into the past in regeneration plans, there was at one time discussion about relocating Basildon ambulance station to where the Dogs Trust is now. And the idea then, we were told by the ambulance service at that time, was they could it was, if they had their base there, it was quicker to access all parts of the borough. You try to access Wickford or Billericay from Nethermain, especially if you try and do it about 5 o'clock in the evening, it's not going to be a very quick journey. And that extra time, medical experts will tell me, but that extra time, somebody with, say, a heart attack could make the difference between life or death. So I'd like to hear a bit more about what you think to response times and arrival times at the scene of an emergency. I could go on, but I think I better give way to somebody else.
Thank you, Councillor Buckley. Councillor Burton Sampson.
Yes, thank you very much, Chair. Firstly, I'd like to thank William and Kay for their presentation tonight. It was quite insightful, so thank you for that. There was a mention from during William's session around residents engaging via phone and then obviously video conference and so on and so forth, and of course needs must at the moment. I do have a little concern around digital exclusion. I'm really pleased that that was mentioned. It's something I'm personally focused on with a number of other organisations, is how do we start to tackle digital exclusion. And I know Basildon Council is also working on a number of projects around this area. But I do worry that at the moment there's potentially a brewing problem within our population. We talk about lack of access when services were closed during the initial wave of COVID. But there's also the lack of willingness to consult because people aren't able to be seen face to face. Either one, because they don't want to do it over the telephone, or two, they haven't got the technology or feel comfortable using the technology to go through a video consultation. So I do agree that it's good to have these options moving forward, but I am concerned about the potential growing health issue we may have now of those who are either choosing to exclude themselves from using the current channels of consultation, or who simply haven't got access to use the current channels of consultation. So a bit of assurance really around, is that on the radar? I'm guessing it is, but the work that's perhaps being done around that to ensure that people aren't digitally excluded, potential to work with other organisations around that, and also is there an awareness of the potential health issues from those who currently are digitally excluded and those that may be growing. I'm also equally disappointed to see the mention of the Gors surgery, Gora Knights Ballards Walk - Sporting Village short term on a public presentation this evening. Now, I've had meetings with Kerry and William and other representatives around this matter over recent months. And I'd like an assurance that my residents who use the Gors surgery have now been consulted of this potential short-term option, because it's now in the public domain. And if they haven't been, I'm really very disappointed that that's been let out in this meeting this evening. This is a serious issue. We have big issues with that surgery potentially relocating there. And if they've not been consulted, and I'm talking all residents, not sticking a notice on the website that was originally planned, I'm talking residents being written to and informed that this is happening. I do hope that's happened, because I'll be very disappointed if this is now in the public domain and my residents haven't been consulted that their surgery is potentially moving to the Sporting Village short term. So a bit of assurance around the video stuff, and then a need to understand more about how far we've gone now with consulting residents of those three surgeries, but particularly those from the Gors surgery. Thank you, Chair.
Thank you, David. Councillor Holliman.
Yeah, thank you, Chair. I'd have to say my initial response was to be highly critical of what we've just heard, but I feel I must temper that, because yes, these are peculiar times we go through, they are difficult times, but I just feel once more that the NHS, in all its various colours, perhaps is struggling far greater than we as the general public are led to believe. And this is certainly nothing new. I totally support the chairman's comments, because being a Wickford councillor, I have been and seen what has happened in Wickford, and considering the development plans that are placed for Wickford over the next few years, quite simply, we will not be able to cope. Now, I don't know how to enforce that message anymore, because we tried to put this message forward several years ago, that Wickford is under enormous strain in terms of its patient support, and we are not getting the service that we deserve. Now, where do we go with that one? I have no idea, apart from funding and also somebody who needs to look at where we are now and where we are going to be very, very shortly if all the developments go forward. The bottom line is that we are being underserved as a population. One thing that did confuse me, which is why I put my hand up fairly early on in this presentation, was to do with the primary care network distribution, as was put up in that first, or I think about the fourth slide. I was a little bit confused on that one, because it appeared to give you a coverage of the Basildon borough, but there seemed to be a complete mismatch in terms of Basildon Central, where Basildon West seemed to be stuck on as an afterthought, going around another area, which made absolutely no sense to me whatsoever. I mean, I would hope that there's a good explanation for that, but if you look at all the other areas, they are containment in terms of numbers, geographical distribution, etc. And yet you've got this elephant in the room in the middle of it, which goes around a central point. And I'm pretty sure we've all experienced NHS peculiarities over the year. And I'm sure there's a good explanation for this one, but I couldn't see why that was designed in that form. But I seriously think, and we've said this for many years now in Wickford, we need a sensible and grown-up discussion on how we provide healthcare to this offshoot from the Basildon Central. It is going to be a real problem very, very shortly. Thank you.
Thank you. Councillor Ferguson.
Thank you, Mr. Chairman. I'm not. First of all, I'd like to thank William and Kerry for coming to the committee tonight and addressing us and talking us through the presentation there. And I'd just like to echo the thoughts of yourself, Mr. Chairman, and Councillor Burton Sampson there. Firstly, on the point that Councillor Burton Sampson rightly raised around the telephone triage service, that I understand why this is important for now, and I've had to use it from my own experience recently, and it worked fine for me. But there's so many other residents that digital exclusion is a real challenge for, and we need to work a way around that. And I want to make sure that's not going to be a permanent plan in place that really will restrict the number of residents that really need to access support at the right time. And secondly, Chairman, you alluded to it in your opening remarks around the Dipple Medical Centre. I think what would be really useful, and I know it's a growing issue for my own residents in Pitsea, is a clear timeline of the plans in place for the Dipple Centre and the consultation that will involve with residents. Thank you, Mr. Chairman.
Thank you. Councillor Blake, did you have your hand up? Sorry, I thought you did.
No, Chair.
Talk about, and perhaps Kerry or William will know the answer to a question I wish to ask now, is we talk about Wickford for argument's sake. Councillor Holliman and Councillor Buckley and myself have mentioned it. Can you let us know at some time on the doctors' lists in Wickford if there is spare capacity, the amount of spare capacity? Because Peter has said he thinks we've got a lot of people coming in perhaps, but we don't know the numbers in the future. But it'd be a good idea, not just in Wickford, probably elsewhere as well, knowing what the spare capacity is on these doctors' lists. So I'm sure that you must have them for when you're planning how we go to the future and what's needed. And on the other one, phlebotomy was mentioned, and I just made a note to myself that I met with Tom Abel about 5 years ago now, 4 years ago, I think it was, when they moved the blood test out of Wickford to Rumwell. And Tom said to me, don't worry, they'll be back in Wickford inside 6 months. And they are still not back inside of Wickford. Blood testing is important to, obviously, the people, and it's difficult, unless you've got a car to go to Rumwell, it's difficult to get to. Anyway, I'm sorry about all that, Kerry and William. You've got a lot was said then, so I'll give you the floor. Either of you the floor now to come back to us, and then I would ask that perhaps Matt, if you've got the presentation, whoever's got it, that is a good presentation, which I think all members of the council should be entitled to see because it covers the borough. Kerry or William, who's going to come first?
So should I kick off and then Kerry join? So there's a huge number of issues to cover, and I'll attempt to provide an update on all of them. Just in terms of the physical space issue, so we did at a point in time an assessment of all of our practices. So we've got 35 practices now in Basildon and Brentwood, and their list size and the physical space they had available to them. And I couldn't tell you what the figures were in Wickford, but we can certainly take that away unless Kerry does have that at her fingertips. In terms of some kind of general issues, so estates aside, so there was a question around the alternative professionals and the kind of promotion of those. So I think there's a huge amount of work that we need to do in collaboration with all stakeholders on how we make it clear to the public about what primary care may well look like in 5-10 years time, with all these different roles coming through and how to access them. We're trying a number of initiatives to better support an understanding of that. One of the things we're currently doing with working with GP practice admin staff is between our physiotherapy provider and the GP admin staff, we developed a pathway whereby the practice admin staff can offer patients physiotherapy as an alternative to seeing the GP for common back complaints, etc., or musculoskeletal problems. There's a series of red flags that those staff need to run through with the patient to make sure it's not something more sinister that the GPs need to look at. But it gives a good, clear avenue then for patients to either accept that offer or wait and see a GP. And it's those type of developments that I think we'll see more and more of over the coming time. From a total telephone triage perspective, it's a national model at the moment. So back in, I think it was probably the beginning of April during the COVID incident, it became a national standard operating procedure for primary care that they would implement this model of total telephone triage, not just for the safety of the staff within the practice, but for the safety of patients. I think we're trying to keep people away from healthcare venues if we can avoid it, given that there will be patients with COVID that come to those centres, and that's why that model was put in place. It works well in some respects in a pandemic. However, it's a model that will need fine-tuning and tweaking going forwards, and it certainly will be a different approach when we're in a post-COVID world. However, I think that initial triage done remotely by the GP is quite an effective way of trying to get the right solution to the patient in a timely fashion. The demands on general practice are such that actually without some kind of clinically led triage, you risk that the person you really need to see is the one that phones you last in the day when there isn't that appointment available. Whereas with this model, you hope to be able to identify those that you need to actually bring forward, get into the practice early on. It has got to have some further work. As I say, we've got to link it with all the other alternative mechanisms of accessing healthcare. I think the digital exclusion piece is a really valid point. It is one of my concerns. I think there are.
William,
sorry. Yep.
William, I can stop you a moment. Kerry's got a hand up.
Oh, sorry.
She's found the gadget. I think she wants to interrupt. You can do that, Kerry, anyway.
Sorry, apologies. But actually, I will come in just very quickly just to answer the question. I was frantically trying to find the detail for you for Wickford Health Centre, which is why I probably caught my hand by accident. And just to answer that question, I've just looked. And in terms of space for planning capacity, so just purely space, not the number of appointments and things, because obviously that's slightly different. But when we're looking at space from planning capacity, so the things that you would see when we're responding to planning applications, they are short on space, which is why they're already on the pipeline as one of the projects that we need to address. What we have done, as you will know, when we were doing the London Road build, we did extend that surgery. We added in, I think it was 3 new consulting rooms for them. It was like a long time ago now, but that was done. Since there's been the change and some more space become available in Wickford Health Centre, they have now moved, anybody that attends that centre will know they've moved into the other side of the building as well. And are being given additional space there. So they have got additional capacity. It doesn't make the building any difference what it was, I completely understand that. And it hasn't taken them off our radar, but it does give them some additional capacity while we're looking to work with the GPs and also the wider services in that area for an extent solution. Sorry to interrupt you.
So the digital exclusion piece, I think we share the concerns around the fact that there are parts of the population, particularly younger people, who kind of readily access technology and are quite comfortable with that approach. There are others who are unable or unwilling to use alternative technologies to access services that they've traditionally gone and access face to face. And I think it affects all sectors, that issue. We're wanting to work closely through our alliance with stakeholders such as the council and Essex County Council on trying to identify who those cohorts are, and certainly there will be people that Basildon Council services are aware of that actually will have the same problems in accessing healthcare services as they do your services. Likewise, Essex County Council through social care, etc., will be aware of people who again will be in that common group of people who we all need to kind of collaborate to be able to offer the right solution to. We're developing as the technologies are being used. We're particularly at the moment, as I say, focusing on things like safeguarding to make sure that when we're doing things remotely, our GPs are looking out for those signs of safeguarding issues that would have been probably more apparent if the patient was sat in front of you in the consultation room. It might be that they were more willing to share something that they're less willing to share when they're sat in a room potentially with other family members. And so we're putting a lot of effort into that piece at the moment, but we want to go beyond that and say, actually, how do we make this more of an all-encompassing and all-inclusive solution, recognising there are people out there who won't have access services since at least March. One of the processes that general practice goes through on an annual basis is where you have got a complex condition that requires regular review. They will be going through the process of contacting patients proactively to do diabetes checks, CHD, whatever it is. And so our are trying to compensate for those who are unwilling to approach practice through that mechanism, so that kind of proactive reaching out as they would have done had it been this time last year, but they're just having to do it through slightly different mechanisms. So it's a bit of a fail-safe, but I still think there's a lot of work we can do collectively on that front. In terms of the geography of the PCN, so this issue around the quite odd geographical lines in south of the A127, it's a very fair observation. So I think we were initially drawing a neater line on the map in terms of what truly represented east, west and central Basildon. However, there was a bit of resistance to that from some of the practices, and our board took a view that actually if collaboration is the key to the success of the PCNs, we are better at compromising a bit on the geography in order to kind of have that coalition of the willing within that area. We engaged with providers, we engaged with social care, we engaged with our community providers on the ramifications of that, and they recognise why we'd need to go down that route and willing to work with us, and that's why it is slightly weird divisions of the PCNs south of the A127. It does feel that it's working, and as I say, because there is that collaboration between those practices, it means that we've not had to kind of deal with that issue at the outset. We've been able to kind of build on relationships that already exist, so that's why it's the way it is. The issue that was raised around the location of the ambulance trust, so the ambulance trust would have done quite a lot of modelling on where their traditional call patterns are, etc., and the impact of traffic at various different times of the day when they're siting all manner of facilities, and so I would think they would be confident that the proposed location would work from that perspective. I think they're always keen to get good access to the dual carriageways, etc., which they would be able to go both north and south and do that, and so they would have certainly flagged if they were concerned about of the impact of the location of that site. In terms of then the kind of more specific issues, so Wickford, apologies if that was the first time that you'd directly heard around the affordability issues with Wickford. I guess with all of these builds, particularly in the primary care land, we are constrained by what is affordable, and we don't set that affordability envelope locally. It is done through NHS England, and therefore there are things that we would like to do that sometimes we just cannot proceed with because of the affordability envelope. I don't know whether, Kerry, you want to discuss the kind of general principles of that and the impact it has.
So with Wickford, sorry. So the other thing with Wickford we need to understand is it's quite a complex project with lots of different ownership models and different services involved. So as I say, with the viability, somebody mentioned earlier, it wasn't just the case of building a building, taking a site and building a building, which is difficult enough in terms of viability. It was actually trying to ensure we didn't stop services and continue to provide services on the same site, which caused us a few issues. And I think anybody that saw some of the plans from the council would have understood how we were trying to kind of manoeuvre around that site while still we're making it safe for the patients. So as I say, we've got some further work to do on that. We need to look at all of the opportunities that might be arising in Wickford and try to come to something that will enable us not only to deliver sustainable development and sustainable services, but also make sure that we don't have to cease any of the work that we're doing or prevent growth in those services in the meantime.
Perhaps, Kerry, at some time when it quietens down a bit, we could arrange, as we did once, I think it's about 2015 now, 14, 15 time, where we did arrange a meeting with yourself, I think Andrew Pike at the time, with Wickford councillors on how we operate in Wickford I think that would be useful from outside of this particular committee. You know, so if that could be arranged sometime, I'm sure Councillor Buckley and Councillor Hollingman would be happy with that. But thanks very much, though, Kerry. Okay. Have you finished, William? I can't see you, so it's difficult to work.
There's a couple of site-specific issues that I should pick up. So there was the issue around travelling to premises. So we're always conscious that when we undertake rebuilds or redevelopments, unless you're locating the facility back on the site that it was originally on, somebody will have to travel further for that service. With all the developments, we had to do travel impact assessments and try to mitigate the detrimental impact of moving services. And then the Knights re-provision is one such example of that. We're working on how we minimise the impact of that, but recognise we won't ever be able to completely mitigate the impact of moving services from the sites they are currently in. We've obviously referred to a number of developments that we'd like to kind of take forward, and with all of those, we will look to see how do we put in sustainable transport solutions that can best meet the needs of the population. But I am conscious that with all the developments we do, as I say, unless you rebuild on that site, you are moving the service from somebody. And with all of our GP practices now, the registered population with that practice is surprisingly far spread. Yes, it tends to concentrate in the immediate geographic area of the practice, but they will have patients in quite far-flung places, and so we just need to kind of take into account where the patients are registered as well as kind of the actual premises itself at the moment. In terms of the engagement process, and particularly around the question that was raised, so we've also there has got to be a full and complete engagement exercise. I guess what we wanted to do today was to kind of be as upfront as we can be in terms of developments that are in train with the wider membership of this group. But I take your concerns on board, Councillor Barton-Sampson, in terms of the comprehensive engagement with the Gora population, and I will come back to you on that matter. In terms of the DIPL, Kerry, I don't know whether there's anything we can say at this point specifically around the timetable. Do we want to give a bit of a flavour as to where we're at with the DIPL development?
Absolutely. So the DIPL development, as some of you may or may not know, does have the benefit of the Estates and Technology Transformation Fund. So in order for us to make sure that we make the most of that funding and develop this project as fast and as efficiently as we possibly can, we are looking to have the outline business case refreshed and completed by the end of March. And that feels like a long time, but that outline business case also includes us working with the independent GP practices that form part of the DIPL Medical Centre and the wider services to make sure that they are absolutely clear and willing to enter into a building in a way that they would need to share facilities going forward. So that does involve quite a lot of legal work as well, which is why it takes a little bit longer. The good thing is that once that outline business case is completed, the main detail before we can get the project signed off would be the full business case, and most of that is technical detail. So that's going to tender and technical detail of the practice and how it will be built and what it will look like. So we're actually at the most time-consuming stage at the moment, which is where we're trying to establish how the new facility will work, how the occupancies will work, and how that will work in terms of the individual practice there as well. So as I say, we are still working on this, but there are lots of individuals involved in this project. It's not simply a case of telling the GPs what they have to do and where they have to go. They are independent businesses.
Thank you, Kerry. Okay, William, is that it?
Yes.
Okay. Can I then thank both you and Kerry for coming along this evening for us and doing the presentation, etc. I think it's been fairly open the way we've discussed things, and I think it's a good hour or so well spent in terms of updating people and the public on where we are with healthcare provision in the borough. Hopefully, that we see some more progress on the areas you've mentioned fairly quickly, but giving to understand the pressures on the NHS at the moment. Can I say one of the things I've found when dealing with the NHS is, as William mentioned earlier on, the number of changes that take place in the organisation. And I know from when I first met Kerry, the number of changes that have moved around since then. She's been fairly consistent there, which I think is very good. Her role may have changed, but she's been very useful in the past. So thank you both of you. You haven't got to stay now and listen to the rest of this. Lucky you. But thanks very much indeed. I'm sure other members would echo that and that appreciation. But basically, we're noting the reports from yourself and William tonight, Kerry, and thank Tomasz and Matt also for putting the presentation together. Thank you very much.
Thank you.
Okay, we'll move on then to item 6 on the agenda, which is the street scene enforcement CCTV trial update on pages 19 to 22. The recommendation there, so I'll read it out so we know what we're talking about, is to note the contents of this report and the outcomes of the trial of mobile CCTV works, and agree that the mobile CCTV equipment will continue to be deployed where operationally required. Mr. Hendry, he's here somewhere. James.
Thank you, Chairman. Waiting in the shadows for the right introduction, which I've got. So thank you, Chairman. Yeah, really, this is something which was requested as part of the feedback to initially there's 2 rounds of member investment which have gone into this one, and we've trialled 3 pieces of equipment to counteract and to try and target fly tippers across the borough. The first piece of equipment, it promised to do a lot and didn't really deliver for us. It wasn't the right equipment for us. The second one was copying a similar authority that had run a high profile similar kind of campaign around the use of CCTV and mobile CCTV to catch fly tippers. Again, that one was found to not really be data secure and to meet the needs of particularly around GDPR. And if the equipment had fallen into the wrong hands, that data could have been, it wasn't encrypted, so it wasn't good enough for us. The third piece of equipment, I'm pleased to report, has worked really well. It's agile, it's portable, it's mobile, it is secure, and it's delivered some good results for us. So we can, the kit that we've managed to purchase with this member investment, the third piece has got up to 10 cameras. We can have those deployed simultaneously at hotspot locations across the borough. Our teams have been trained on how to download the equipment, to inspect it, to put it up, to make sure the signage is correct, to make sure that the data protection impact assessments are completed properly. They have night vision. What we have done is we've deployed them at a wide variety of different types of locations across the borough as part of the trial to get a good understanding of where they do work and don't work. We've put them into all kinds of different locations based upon the number of reports that we've got and where we've had hotspot areas. We've tried to also have a variety there as well of locations. And I guess that all locations, they're all met the legal requirements, and we've made sure that there was adequate signage and everything else put up. In terms of results, we've had, as a result, direct result of the having the cameras up, we had 11 fly tippers identified, as a result of the trial. There were 6 fixed penalty notices issued, which were paid at a rate of £120. There was 1 fixed penalty notice which remains outstanding for payment, which if not paid will proceed to prosecution. One of the fly tips which was identified was large enough, so that went above the fixed penalty notice and will go straight to a prosecution. Investigations are ongoing with that one. One investigation did not return sufficient evidence to meet the evidential threshold against which enforcement action could be taken, and 2 incidents that resulted in identifying falsified or cloned vehicle registration plates, which have been reported to Essex Police. So I think there's kind of a real good flavour of where we've had the successes there. So what the way that it tends to work is where we've had the better results have been in areas where we've been able to get clear footage, areas that are accessible to vehicles, that have public access. But what we've made sure is that we've got the right level of officer resource to review footage carefully to make sure that we've got the right information. I think that it's been less successful in residential areas. It's a useful tool to have. Nothing beats boots on the ground, talking to our communities, listening to our residents in the areas where we've got fly tipping in residential areas, and that yields better results for us on that one. And essentially the recommendation of this report is to note the contents of the trial, note the contents of the report, the outcomes of the trial, and to agree that officers continue to deploy mobile CCTV where operationally required. Thank you, Chair.
Thank you, James. Can I just say, when we talk about this, we don't want to get into the detail of how, where, and how we operate, but we are targeting right across the borough. We're meeting the legal requirement. James mentioned ones where in residential areas it's more difficult, but I have asked officers to look at the way some councils are operating by identifying the perpetrators individually who are fly tipping without vehicles. We're looking to see if that can be done. But I think the message has got to go out there. We now have this mobile CCTV. We can operate across the borough. So if you start fly tipping in Basildon, you're liable to be caught. If you're caught, you're going to be fined. Councillor Buckley first, then Councillor Holliman.
Yeah, thank you, Chairman. Just a couple of points. I'm completely in support of this project. I think it's the right thing to do, but just a couple of questions around the implementation on it. Just reading the report, it says basically we've got a base unit which supports up to 10 cameras. There is a comment in the same paragraph which refers to supplementary units. I'd like to know if we acquired supplementary units, the price of which is not shown in there, would this mean it would support more than 10 cameras? In which case, obviously, that might be something we want to look at through the budget process. Secondly, what is the cost of additional cameras, or do we know? Mr. Hendry mentioned about, used the phrase, areas where we can get clear footage, and I think that's particularly aimed at individuals. And I was just minded of having seen the quality of footage that appears on the depot cameras. It would be very easy to identify an individual from that. Are these the same standard? If not, what's the issue with actually getting clear footage? Is it obstacles like trees in the way, or is it just the quality of the cameras?
I'll let Councillor Holliman come in first, and then James or Paul will pick those answers up. Peter.
Yeah, thank you, Chair. I have to say straight away that I don't know the answer to this. I was hoping to get some sort of feedback from everybody here, but one thing that has always come to mind on this thing about fly tipping is that I get the impression that the fly tipping seems to occur in certain places across the borough with more regularity than others. And I'm just wondering what the impact would be if we flagged for the borough the areas which receive the most fly tipping, with a cautionary note to say that these are areas which are a red area which is more policed than others, which would in effect have a counter reaction to people that may want to place various items in these areas. I mean, as I said, I haven't I haven't thought this through completely, as you probably can see, but it just occurred to me that, do we want to make people aware that we know the areas where rubbish is dumped regularly, or do we want to be completely covert and try to catch people, you know, out of the shadows. I'm completely open to any suggestions coming back from that.
Can I come back on that, Peter? I'm identifying what we actually do things. I'll take this point. When you catch somebody, the word gets around from, no, don't fly tip there because I got caught there. So beware. So they find somewhere else. I think the word goes out. I'll give you an example. Recently, there was some fly tipping in just on our side of the border from Rochford. And I think it came about because there's a regular fly tipping spot just along the road towards the Roworth, where I think the farmers put a sign up, said CCTV cameras in operation. So I think probably someone drove past that to come a bit further down the road. I think there's a case for signage, but I wouldn't like anyone to know where we are putting our cameras, because they're mobile cameras. They'll move around the borough, and that way we will catch more people who are fly tipping. James.
Thank you, Chairman, and some really good questions there. I'll take each one in turn. So Councillor Buckley's questions. The comments around clear footage really relate to where we've got sight of where the dumping's taking place, and obviously for evidential purposes, if it happens slightly off camera, that obviously does affect the quality of the evidence. But absolutely, the cameras that we're using now as part of the third piece of equipment, if it sees somebody doing it, they're clear enough and admissible for, you know, they're good enough for court. So we're happy with the quality. They are of a high quality, and we have had the successes that we detail within the report. The kit that we refer to is, once we've got the base station as part of the funding which is within the report, what we can do is we can buy additional kits on top of that. We don't need to buy any more base stations. It's just a set of, to give you an example, a set of a hard drive which can run 3 high definition cameras, an infrared kit and 4 batteries is about £3,000. So it's £3,000 on top of that for every set that we have, but we only need one base station, which we've got, and we can run, you know, all it is, the base station, basically you plug the hard drive into, it downloads the footage and then enables you to view it on the accompanying PC once it's decrypted. So hopefully that answers those questions. The questions from Councillor Hollyman, in terms of flagging up areas around the borough, we continue to follow current legal guidance, which is around being fair and proportionate and making sure that there's adequate signage there. So what we have to do is we have to be, these are overt, they're not covert cameras. And we are obviously, part of what we're doing is to echo Councillor Harrison's point, is this is about where we do get successful prosecutions and results, and this is something that you know, where we are getting these good results, it's about making sure that we're making people aware, because prevention being better than cure after it's happened. Thank you. Hopefully that answers those questions.
Councillor Ferguson.
Thank you, Mr. Chairman. Not really a question, but more of a point. Just wanted to thank Mr. Hendry and the team for the work that they've done here, and I'm sure I speak for all councillors when I say how frustrating and not acceptable fly tipping is in any form, and the frustrations that our residents feel around that. So I'm really pleased to see this report and hear that the initial pilot has been a success and that it's continued with. What I think is also important to note is that this isn't one solution solves it all, that we're actually trying a number of different approaches here to resolve the issues of fly tipping, because it is a challenge, and I think it's important that we respond to that.
Thank you. Okay, I've got no other councillor. Mr. Brace, nearly.
It's just to mention in the report on page 21 in your pack, we will, after this meeting, be working up to make it, as it is a pilot, as Councillor Ferguson has quite rightly pointed out, it is a pilot, but we will start now working this into what is normal council business. I think you can see we're getting probably things that we wouldn't necessarily have caught without CCTV, and that deterrent, that extra weapon in our armoury, really, to try and stop it, we think it is worthwhile carrying on with. So we'll try and build it into our normal work programme, as it were, for CCTV. It will also help where we can to spread out this test, has also meant that we will also look at antisocial behaviour. where we have particularly bad areas. So it will be per se managed mostly through our CCTV manager that works under Leslie O'Shea, the Assistant Director for Housing. But we will always have access to it for environmental reasons. But we've done the test, so it may well be that we will expand the sets, as Councillor Buckley has said, to help support antisocial behaviour and fly tipping, which is technically antisocial behaviour, so that we can identify individuals that are not making our borough as pleasant as it should be.
Thank you, Paul. Okay, I'll take the recommendation now, which has been read out twice on page 19. I will vote in favour. Councillor Ferguson.
Councillor Blake's indicated he wanted to speak. Councillor Blake's indicated that he wanted to
Oh, I'm
speak.
sorry, I didn't see you, Kevin. Councillor Blake, did you wish to speak?
Yes, Chairman, thank you very much. Just a question for James. What is fair and proportionate, and who decides what that is? Because affordable housing comes under the same category, but that's not your question. I want to know what is fair and proportionate and who decides what it is. Sorry, James.
Good question. James.
That is a really good question. Thank you, Councillor Blake. So fair and proportionate refers to a test in law. I'm not a solicitor, but it does mean obviously the guidance that we've got, particularly around fly tipping, depends on the scale and severity of the offence that's taking place. So a couple of years ago, there was a decriminalisation of the lower level fly tipping, by which a fixed penalty notice was brought in for low level stuff. So that's household waste items and so on. If, for example, we get a van load of material that's clearly a commercial enterprise, that somebody's cutting corners and tipping that down a country road, that would not qualify for the lower level household waste. That would then be a direct to prosecution. So we've got guidance around it in terms of the legal side of things. We tend to work on sort of the operational side of things, and that's kind of where the tiers are for us. So there's kind of the two levels there, because prior to the introduction of that fixed penalty notice, we had to treat the person who'd left a mattress out, and also the companies the road companies that are making lots of money every year through fly tipping, exactly the same. But what this has is this gives us the opportunity to be fair and proportionate in our response to the offence which has taken place, or we believe to have taken place at the time. Hopefully that helps.
I think that's a good answer. Okay. Thank you very much, James. Okay, I'll take the recommendation now then. On page 19, I'm in favour. Councillor Ferguson.
In favour.
Councillor Holliman.
For.
Councillor Blake.
For.
Councillor Buckley.
For.
And Councillor Burton-Sampson.
For.
Thanks very much indeed. We move now on to item 7, Beauchamp's field options and future management, which is on pages 23 to 28. On the recommendations, so we understand, on recommendation 1, I wish to add the following words after Giddings Copse, which is in fact deleting the full stop and adding together with the proposed path from Rumwell to Battlesbridge. Members, later on the COVID impact assessment, you will see that is one of the projects which we've started, and as that path would now actually go through this area as well, which is now come under Basildon Council's control, we should make sure that path along the river is included when Beauchamp's field is planned. Is that okay? That's the recommendation. Other no changes to 2 or 3, just to add that to the end of 1. Okay, I'm in Beauchamp's field. The report is there. I think, Grant, do you wish to go through that?
Happy to, Councillor, if you'd like me to.
Let me clear first of all, it's quite detailed. This is only the first stage. Can I just ask, it's 26 acres. I've been quoting 21.5 originally, but I see it's now 26 acres. Is that because the 26 acres now includes Giddings Copse? Okay, Grant.
Okay, Councillor, thank you. Oh, just try to open the report. Apologies, it's not there.
Okay. Well,
God, it's not opening for me. I'm struggling with my internet, I must admit, at the minute.
It's the piece of land which was formerly the playing field, detached playing field for Beauchamp's school. It's been theirs for about 40 or 50 years, or since the school was built. And the lease, they returned the lease to us when they had their 3 or 4G pitch inside their ground. Returned the lease, so it then became public open space for Basildon Council to use. And as the committee had agreed previously, we look at proposals to what would come to become in this area. And now that is where we are tonight. You found it now, Grant?
Yeah, I found it wasn't opening, but it's opening now. Thank you, Councillor. So yes, I think I'll try and come in there where you left off. But yeah, so the former Beauchamp school site was principally used as playing pitches, and it's no longer required by the school, so they surrendered that lease and therefore is returned to the council's responsibility. It's obviously situated between Wickford Memorial Park and Giddings Copse, which are both managed, I should say, by Basildon Council. So this report looks at how we might use this site to the best of its ability for community use. So it's based on a proposal of an extension to Wickford Memorial Park, in essence, looking to provide a corridor of biodiversity between this site and the park as we know it, but looking at therefore, I guess, to provide a contrast between the different kind of formal park with play area and sports pitches and the like, and so much more, of course, in that park, along with an area of high biodiversity, and that would allow us to continue to meet the work of our pollination action plan, which had come through this committee previously. The concept, and it is a concept that we're very, very keen on. We've been talking to other ecologists out there in the community, is to create a series of wetland ponds, planting of a mixture of woodland and wildflower meadows, and the planting of a community orchard. And we would like to do that for engagement with a number of parties, including people like the Forestry Commission, the Woodland Trust, and the plethora of local groups that are very engaged in biodiversity and have that interest. So this site is not previously accessible to the public, and as you would have seen from the recommendations, part of tonight is seeking approval for the site to be openly accessible to the public at the point we can make it safe. So I would say that looking at the recommendations, I think it's important to point out that there's three things: looking to authorise the site becoming an extension to Wickford Memorial Park, creating that corridor of biodiversity, as I discussed there, permitting open access to the site at the point at which it's safe to do so. And the third point really is that we're looking for authorisation to go and seek the relevant external funding to be able to explore these improvements, because as you would have seen from the report, this is currently not costed, but we are very hopeful with a community project, an important project like this, that funders will look on it very kindly, and we've already had some of those early conversations with people like the Forestry Commission. Thank you.
Have we also spoken to the Woodlands Trust, haven't we, Grant?
Woodland Trust, yes. Woodland Trust, Forestry Commission, yes. Sorry, both of those.
And we're looking at an initial cost of about £50,000. And later on the agenda on the COVID impact assessment, I'm going to suggest the way we can put some money towards it, so that we can always say there's some match funding from the council towards these grants.
That would be very helpful, as always.
If we get a grant. Councillor Hollyman first.
Yeah, thank you, Chair. I'm not totally clear on the area exactly that we're discussing here. I mean, it's obviously the park area, which I fully understand. But something which has plagued me as a Wickford councillor for several years now, looking at Memorial Park, is anything to do with land down towards the Crouch River, because in the past this has caused a whole raft in the river. Never mind. It's caused a whole raft of discussion, talking about who is actually responsible for the upkeep of that river. As I understand it, the river is part of Essex Waterways, and then you have various other management groups that are responsible for the river banks, etc. I've always thought that whole stretch of river going down the bottom of the Memorial Park and now into this extended area is absolutely ripe for development as a waterside walk, which needs to be cleaned up and redeveloped, because in theory you could almost walk right the way down to what is classed as the arches, just beyond where the water cleansing plant is. But I understand that this is really the concern of 2 or 3 various groups. So I was hoping to see, when I saw this turn up on our agenda, that there would be some separation here for developing that particular area of the Memorial Park. So any clarification you give me will be most appreciated.
Well, I'll try and help you there, Peter. I mean, currently you can walk alongside the river behind the fence of Beauchamp's Field, along through under the railway bridge, through the arches. There's a public footpath there at the moment. You can walk further, not around the sewage work. You can get a fair way along there towards Shopgate, and there is a footpath there. That is why we were looking at a footpath, as proposed by some people in Wickford, to run from Rumble, where a path actually starts, and go through to Battlesbridge. Now, there's discussions that are taking place with the Environment Agency, I think it is. Grant, you'll nod if you're correct, about how that will work in relation to the river. But this particular item here is not about the river. All I've suggested tonight, that when we look at this, we consider the proposal for a footpath all that way, so that part of it becomes alongside it, but not the main issue tonight. I saw Councillor Burton Sampson had his hand up.
Yeah, thank you, Chair. Just very briefly, I just wanted to thank the officers for this piece of work. I mean, this is an absolutely great use of a piece of land that had become redundant, and using it in such a way to enhance the environment and to create more public space for the people of Wickford and the wider area, I think is fantastic. You know, there's always the danger when a piece of land's redundant that it could get built on, and I'm pleased to see that this land's going to be given back to the community, and is going to become a huge benefit to the community and to the environment as well. So really good piece of work, and it just shows that this administration's committed to the environment and to creating great high quality public spaces for our residents as well. So thank you, Chair, and thank you to the officers for the work on this.
Thank you. Councillor Buckley.
Yeah, thank you, Chairman. As you won't be surprised, I'll support the proposal as you've amended it. Just wanted to comment on a couple of points. And you're right in saying this doesn't relate to the river, and I do think that at some point we do need to have an agenda item on the river, and the failure of the Environment Agency to look after it, to give access and visibility to the river all the way from Castledon Road to Battlesbridge, I would hasten to add. I might declare a slight interest in the Basildon Road bit.
Are you declaring an interest as a Basildon Road resident?
Yeah. One point I did want to make, I'm in agreement with your comments about the path going through to Battlesbridge, and I have walked that area a number of times myself. I used to walk it a lot when I was about 10 years old. But one thing that has happened in more recent times is the guy that owns Skitex at Battlesbridge keeps on claiming to own the riverbank and the land adjacent to it for some distance upstream of the locks. I have no idea whether he actually has any legal ownership on it, but I think officers need to check that out, because certainly he has blocked people from going on there before.
Thank you, Malcolm. Thank you. So, anyone else on this item? If not, I'll read out the recommendations. That we authorise the Beauchamps Field site to become an extension to the Whitford Memorial Park.
Councillor Blake, I think, wants to.
Sorry, Councillor Blake.
Yeah, I have got my hand up, Chairman.
Where do you put your hand, Kevin? Right.
No, it's on the screen as well. I wasn't going to say anything, and I do like David, I have to say, but let me just stress the politics there. No administration, not just this administration, no administration, had they been in power, would have even thought about developing on that. I just want to make that clear. But I do agree with what David said, that this administration at the moment wouldn't, and nor if there was a Conservative administration would they do the same. And I can say that as an independent.
I agree with you totally. There was no even mention of any development on this site. It was quite clear this is going to become additional public open space for Wickford. You know, I actually spoke to the headmaster at the school when the lease was being handed over, you know, to make long story, but there we go. I'll finish. Can I finish now, Kevin? Right, okay. The recommendation. We authorises the Beauchamps Field site to become an extension to Whitford Memorial Park, creating a corridor of biodiversity, including wetland and wildflower habitat, woodland, and a community orchard from Whitford Memorial Park through to Giddings Copse, together with the proposed path from Rumwell to Battlesbridge. 2. Permits open access to the site to the public. 3. Authorises external funding opportunities to be explored to contribute to the cost of the delivery of the works. Okay, I'm going to vote in favour of that, obviously. Councillor Ferguson?
In favour.
Councillor Burton-Sampson?
In favour.
Councillor Hollyman?
For.
Councillor Blake?
In favour.
Councillor Buckley?
For.
Thank you very much. Right, we'll now move on to item 8, the Youth Zone proposal update on pages 29 to 34. The recommendation here tonight is a single one, that the committee notes progress made since its September 2020 meeting on negotiations with the landowner of the identified preferred site, development with negotiating the various legal agreements with onside, and undertaking a consultation with local young people. Now, who's going to lead on that? Is it Grant or Paul?
It's me, Councillor.
Where you go.
Okay, thank you. So I won't go too heavily into what a youth zone is. I think I've done this a number of times in recent months, but obviously the committee will be aware that the council have been pursuing the proposal to build a youth zone in the borough, alongside working with Onside, the national charity for youth provision, looking to target young people aged 8 to 19 or up to 25 with additional needs. So as the chairman said at the last committee on the 23rd of September, an update on these actions were given, and it was requested that I came back again this month to provide further details, which is the basis of this report. Taking them one at a time, negotiations with landowners. The update on this is that since the September committee, Officers have been working to reach an agreement with on terms with the landowner. Discussions remain ongoing with that landowner to draft the proposal. A draft proposal has been made to them by the council regarding heads of terms. There are covenants on the title, and you would have seen by now that a report went to Policy and Resources Committee on the 21st of October, which for the first time named the preferred site in the public domain, that being the car park 11 in Basildon Town Centre, which is in the ownership of Basildon Town Centre Management. So officers are discussing that, making positive progress, I understand, but there are some covenants on the site that need to be lifted, and that's part of the discussions, and they continue. At the last meeting, at the Policy and Resources meeting on the 21st of October, therefore, to inform the committee, approval was given in principle for taking of a long lease on that site if the negotiations could be concluded, and it approved delegation for the Assistant Director for Growth to enter into detailed terms to be negotiated for the enabling the youth zone to progress, and both of those were approved by the committee. The second item that we're progressing on at the moment is in relation to negotiating the various legal agreements directly with OnSite themselves. This work has begun, and work to advance reviewing and consulting on the various provisional legal agreements is underway. Principally, that's looking at three things: the establishment of a new youth zone operating charity, which in essence will be the Basildon Youth Zone charity itself, the lease of the site for youth zone to operate from, which obviously links to the above item, and the development agreement for the works to enter and to enter into an operating agreement from that point of view. So at the Policy and Resources, I think that was advanced somewhat, and I'm hoping to come back to the committee later this month to be able to get some of that formally agreed, so as the committee can decide on how it would like to, if it would like to progress accordingly. Finally, consultation with local young people. So a consultation exercise is very much at the later end of being prepared now. This will look to understand what the priorities of young people in the borough are in terms of their social and wellbeing needs, and enable us to design a youth zone that therefore meets the needs of those young people in the best way possible. Since the last meeting, it was agreed as an addendum that the co-design of the consultation would be agreed with the chairman of this committee, which has happened and has continued to happen. And it's been agreed since that point that the focus of the consultation will be with schools, looking to split it between those that fit within the 8 to 10 period at a primary level, and then those 11 plus with the senior schools. With directly working with the schools to help get them to encourage students to complete the online survey. Of course, a lot of things are happening in different ways at the moment. It's been a challenging year really for engaging with many partners, especially schools. But we're very pleased to say that tomorrow we've got 2 Zoom meetings set up separately with primary and secondary school heads and representatives, which will be led by the chairman of this committee, working with the leader of the council to discuss the consultation with school representatives, present what the youth zone is if those haven't seen it, to answer any questions, and just really to ask them to engage their students with participating, so as we gain an understanding as best as possible of what is important to local young people. Now, of course, we recognise that not all young people are at school, especially those that are up to 25 with additional needs. So it should also be noted that we're also looking to our communications colleagues to use our communications channels and social media to promote this far and wide, and that is very much underway too. Thank you very much, Mr. Chairman.
Thank you, Grant. Okay, thanks for that. Those webinars with the schools are tomorrow. Hopefully, I think OnSite are attending as well, I think, aren't they, Grant? Yes, I thought they were. Okay, members. Councillor Buckley.
Yeah, thank you, Chairman. I'm glad the location is now in the public domain. I had seen it on the previous reports. So I've just got a couple of points. We've been through the concept of the youth zone in the past, and I've made my views clear on it. But as part of the consultation, which you said that you will be agreeing, a question to you, and then I've got a couple of other questions to the officers, so I'll do them all at once if I may. A question to you is, will you ensure that that location is part of the consultation? Because I think that is, for me, an issue for those people that are not close to the centre of Basildon, and it will give an indication of whether it genuinely will have district or borough-wide take-up. The other couple of points I wanted to make actually relate to the financial implications. And under financial implications, we all know that the council, under the current draft agreement, would contribute £4.1 million. Within the report, there are comments about ongoing costs. There doesn't seem to be anywhere an indication of the servicing costs of that capital money. So if it's not available from the officers tonight, if that can be confirmed in writing later, that would be fine. And the second point actually relates to the same paragraph, also on page 33, which says that Onside will commit to using all reasonable endeavours to secure the balance of capital funding. Apparently they've been successful in the past. What's going to happen if they're not successful? Because times are very different now in terms of the way the economy is and so on and so forth. So I just am a little bit uncomfortable about what's going to happen. We commit all this money and then they can't raise the balance. And again, we have similar issues that relate to the ongoing revenue costs. If they can't be answered tonight, I'm perfectly happy for a written answer to those, Chairman.
Thank you, Councillor Buckley. On the first one you asked of me, yes, it will be quite clear in the consultation that the youth zone will be in the Basildon town centre. That's been made quite clear. I wouldn't put car park 11 because no one will know where, was it car park 11? Whichever one it was, no one will know where that is. So we'll make that quite clear, and I insist upon that because I think the connectivity for youngsters across the borough is very important. So one of the questions would be, if it was there, how would you get there? Do you need transport, etc., etc.? It's quite a wide-ranging consultation document. I've gone through it now on 2 or 3 meetings with officers, so quite clear on that. Mr. Brace, do you want to come in on the financing and any indications of where Onside might get their money from?
So just to clarify a couple of points for members, it is up to 4.1 million. So obviously at this stage, the building has not been designed, the building has not been costed. Onside have given us the maximum figure to build a facility, which would be around about 8.2 million. So we take 50% share in affording that. It's their responsibility to raise the other half. But that is to a maximum of that figure. It's not any higher. So we have, on many conversations, Councillor Buckley, I can assure you, asked what the success rate in terms of their other 14, I think now, Grant, isn't it? 14 youth zones they've got and raising the money. And particularly our questioning was a bit more robust now with COVID. And interestingly, they have found more money available during COVID from very different companies that were giving small amounts of money previously, which have said, because of COVID, for example, a haulage company that has seen an increase in their trade and they've donated far more. Their profiling, their fundraising has clearly been working over a hell of a lot of years. They have done well. They have succeeded in every one. Clearly, if they cannot raise the money, if they didn't believe they would be able to raise the money in the timescale that they've got, they wouldn't be doing a deal with us at this time. It's them that choose where they go. There are a list of people that want a youth zone, other towns. They are confident they can raise it. So there is also, and we'll probably speak about it more in the report that comes on the 25th of November, but there is a government fund called the Youth Initiative Fund, which certainly the Prime Minister and DCMS are backing, because they're understanding that the impact of COVID is having in young people. So there is that fund, that's several £million in that pot, which again is available potentially for us to get grant funding with onside to be able to support the building and potentially revenue funding of the building. So there's a lot of things that will be happening on finances. So certainly I will provide you, I haven't got at my fingertips, we haven't got the fingertips I've just tried to find out if we have got it to hand, but I'll give you the servicing costs of the debt. But obviously that's the servicing of the debt if we have to have £4.1 million. But at this stage, we don't know what that figure will actually be.
Sure. If I may, Chairman, I accept that their 4.1 is a max, but it's if you could prorate
it's fine. One moment, please. Raise your hand and I'll call you in. Mr. Brace, if you could make, on the 25th of November, which report comes back, can we make sure that information is in that report?
The financial appraisal of the project will be in the next report, because we will be effectively saying go. So that will be hopefully at the next meeting, all ducks in a row for that next meeting. So that's what we will be doing. Yeah, all of it will be there for members. Okay.
I should add also that onside have just recently advertised a post to actually work on getting income for the Basildon Youth Zone, and they've just advertised that last week. Councillor Ferguson.
Thank you, Mr. Chairman. Just really want to reiterate how important I think this scheme is to the young people that are going to benefit from the scheme and to the wider borough. And I'm really pleased by the progress that we've made here. I firmly believe that there has never been a more important time than now for our young people across this borough to get the facility that they need and they deserve, to give them the skills for so many different aspects of life, to interact with so many other young people, to access wider support they otherwise wouldn't be able to access. And I know firsthand the benefits of good quality youth work and what I believe this to be. I'm also really pleased to see the progress here of the negotiations that are going on with the landowner and the various legal agreements that are taking place. But what I most want to comment on, and thank you personally, Mr. Chairman, and the leader, is your involvement in the consultation. That for this to be a success, it's really important that we get the widest source of information from as many different aspects within the community. And I think your involvement and that of the leader of the council being involved in the Zoom calls and the wider consultation with young people across this borough is so important. So thank you for bringing this report forward.
Thank you. Thank you. Right. I've got no other member indicating they wish to speak. Oh, Councillor Blake, where do you put your hand? I've seen it this time.
Yeah, thank you, Chair. Just a couple of things. I thought long and hard about this, and I will support this recommendation, but I do have reservations overall regarding the youth zone, and that's possibly due to my I'm half full, I used to add, rather than half empty. But I have reservations on the timing of it due to the circumstance we're in as a country at the moment. So I have reservations on that. I have reservations on about it, and this will come out no doubt in the consultation, which is why I will support it. I have reservations about it being the right place. How do people from other areas of Borough, in particular Whitford and Billericay, get back? They might be able to get there, but it's in the evening. So those sort of things hopefully will come out through the consultation, and therefore I can support the recommendations tonight. But I have reservations overall for issues like that. Now I hope, and Chairman, with your support, if it'd be possible for me to sit down with some officers to them to go over it in a bit more fine detail. I want to be half full on this. In fact, I want to be full on this rather than empty. But so, if that's okay with you, I'd like to sit down with officers and go through this in a little bit more detail to give me peace of mind.
Thank you, Kevin. you know me, my style is I've no objection to members talking to officers. The more knowledge that's out there on what we're doing, the better. There's more understanding then, and I think then there's far less, sometimes opposition, but sometimes people come across and sometimes people will present a problem we haven't seen or I haven't seen. So I think that's important. On the question of where it is, on side of said, on the connectivity, and I've looked at what they do elsewhere and amongst some of the 14 other ones they run and how they bring youngsters in and take them home from outlying places. That's to be commended, and I would want that to happen in a Basildon youth zone, and so would officers and other members. So I think an on-side, I've spoken to Claire, and I can never remember her surname, it's a long pronunciation, but I've spoken to them and they assure us that that will happen, that will happen. So as long as I get those assurances, I'm on board, because I want it to benefit the whole borough, and I'm sure other members do as well. Okay, I'll now take the recommendation then that the committee notes progress made since September 2020 meeting on negotiations with the landowner of the identified preferred site, development with, negotiating the various legal agreements with on side, and undertaking a consultation with local young people. I will be voting in favour. Councillor Ferguson.
In favour.
Councillor David Burton Sampson.
In favour.
Councillor Buckley.
Against.
Sorry. You're muted.
Against.
Thank you. Councillor Blake.
In favour.
Councillor Hollyman.
Abstain.
Okay, that's carried. Thank you very much. There'll be another report at the next meeting on the 25th of November. Right, item 9, update on members' investments and projects. I don't propose to go through them all individually, but I thought it was important that members did have an update on where we are with all the things this committee has been doing since in this municipal or last municipal year now. So if we go through that, you'll see down the side where we are with them, the status. Some have paused, some are restarted, some are ongoing, and some have been completed in various places. The completed one is, I think, on the members' investments. So unless Paul wants to indicate, I'll go through the projects first of all. On the projects, Mr. Brace, is there any you wish to sort of highlight?
Well, it kind of matches. I'll be doing my COVID update for this, and of course, with our lockdown starting, obviously, Paul Grant's come back from a week's leave, and we've been polishing off the Pitsy Pool report at the same time that we have been informed today that SLM, our contractor, are obviously putting the vast majority of their staff back into furlough. So we will be checking tomorrow with the senior management of SLM. We have the information from them, but it may delay that for a month or so, because the report will be dealing with how we continue that project. It shouldn't delay the report, but it may delay us being able to get going, which is unfortunate because they've been very good since they came back. So it is restarted, but obviously we may just have a month's delay while we're in lockdown. So apologies for that, but that's kind of a today piece of news.
Yeah, thank you.
The rest, I think, is self-explanatory of what we can do, and equally, I will point out to members the ones that we have ceased, which we can't now. We know we cannot deliver.
Okay. Can I just mention, we're on page 36, the waste strategy. We have a working group going on that, and we've met now three times in the last few weeks to run through where we are on the first phase, and they will come forward with a recommendation, which may not be which will probably be a majority recommendation, which will come to this committee on the 25th of November. So this goes along with the strategy which went through the committee at the beginning of the year. So that's coming up, and that's going to be a very important decision to be made by this committee, because we're tied now by the circular economy package, which was agreed when we were in the EU and is now law in this country. It's the environmental bill, which is now going through the House of Commons, which is going to become law very shortly. And also the climate change bill, I think it's called, which was enacted, actually it's an act in 2018, which is going to have a big effect on how we proceed generally. And we've got some big decisions to make on that as well coming up. So there's a lot going on this committee. If I can dwell on the members' investments for a moment, I'm still anxious to get the CCTV in Lake Meadows, which was the additional one. We are now waiting, I think, for the CCTV panel which is an officer panel, which has to meet legal requirements. To final decision on that. Am I correct, Mr. Brace?
Yeah, and we're taking it needs some more funding than was put in by this committee, but we are taking that from the CCTV pot. So we're just working that through with making sure we've got the money in the pot, and then that work will commence. So we're hoping to get that done very shortly.
And on the additional waste bins, we put money in for additional waste bins across the borough at the request of members. They were all requested and the money has now been spent. The items I wish to look at are two items: the water fountains, which were proposed in Wickford Memorial Park and Wat Tyler Country Park. There's £14,000 have been put in for those, but at this point in time we cannot proceed with those. There was also £3,000 put in for the Christmas High Street closures for Billericay and Wickford. I'm proposing under members' investments that £17,000 goes towards the Beauchamps Field funding, and that would act as a matched funding for any grants we can get from people outside of our control. So I'll make it on this item. I'm recommending that the £14,000 from the water fountains and the £3,000 from the high street closures goes towards the funding for Beauchamps Field. Have I got a seconder for that? Councillor Ferguson, thank you. Councillor Buckley.
Thank you, Chairman. I'm quite happy to see the money diverted, as you said. I just wanted to make one point about the future of the Beauchamps Field, and I think it's right to integrate it into Memorial Park. But bearing in mind the large number of sports pitches over there, I would just like to suggest to you that whilst this does need investment, it should be tried. We should try to keep it as an informal space within that park, rather than becoming additional playing pitches.
I think the intention, if you read the report, was that we would come informal space as wetlands, ponds, a community orchard, extending Giddings Copse, because if you take the barrier down between Giddings Copse, and you can enhance that quite a bit.
Yeah. I'm not sure about the wetlands bit. I don't know if you've been to the wetland area up at Wallasey Island, for example, but they flood it to make it a wetland, and I'm not convinced
let's wait and see, because I already
I'd like to see the plans.
Let's wait and see, because I already know that discussions have been taking place with at least one expert on what we can do there. So I'm hopeful that they're going to come up with the answer. Otherwise, that recommendation previously tonight wouldn't have been the same. Councillor Blake.
Thank you, Chairman. I'll call you Mayor then. Just a quickie. It relates to that, and it's really a question that I should have asked earlier regarding it. As I understand it, if we lose, I mean, I've refereed many a time on those football pitches. That's probably why they gave the lease up. But I'm just wondering whether we normally, as I understood it, have to whatever football pitches we take away, we have to replace under Sport England. Has that changed or whatever, or am I totally screw with on that one?
Mr. Bryce.
Yeah, they were an extension to the school field, so they weren't publicly accessible football pitches, so they don't need to be replaced. So that is the reason why.
And Kevin, they could only give up the detached field once they had the 4G or 3DG pitch, whatever it is, within their own area. So it was, you know, and Sport England and the FA paid for that as well. And there were lots of conditions to that as well. So, okay. So basically, I think these are for noting, aren't they?
Yeah, and your recommendation.
Subject to the recommendation I've made on the £17,000. Okay. I'll be voting in favour of noting with that additional recommendation. Councillor Ferguson.
In favour.
Councillor Burton-Sampson.
In favour.
Councillor Buckley.
Favour.
Councillor Councillor Blake.
In favour.
Councillor Hollyman.
Yeah, 4.
Okay, that's carried. Thank you very much indeed. Right, item 10, we come to the COVID-19 impact assessment, which was circulated earlier. And I'm going to ask Mr. Brace to run through this.
Yeah, as members, just to give you an update on the financial position, obviously there have been a number of announcements over the last few days. Unfortunately, we haven't got all the detail yet from government. Obviously, there's quite a lot happening in the early part of this week, and no doubt we'll go through to next week. So we will probably at the next meeting be able to give you a greater update on the financial impact of the authority and also on the services under this committee. But our finance colleagues are working quite hard to kind of decipher what that means for us and what position that puts us in terms of our income support. The government have also announced that our externalised leisure centres also have a pot of which we can apply for some money, as we have had to assist to keep those facilities running. So all those things are yet to have guidance for us to follow. So we will update you as soon as we have the information, but we are waiting. In terms of our environmental services, building control is still operating, and for lockdown, we will continue to operate. Otherwise, the building trade unfortunately can't. And obviously, it's clear from the regulations that the building work needs to continue. Refuse and recycling service, I can announce that, yes, it needs to continue. And certainly, the only service that we can't deliver at the moment is the crunch service because it's not safe to do so. But I can announce that both county and we will continue to keep our municipal sites open, our recycling centres open, so we won't have that barrage of problem reopening even after a month's lockdown, because I'm sure as people at home, they'll start clearing out again. So they remain open. Car parking, as members will know, we started to get car parks filled, so we have now gone to the 3 hours free, and then if people are there longer than that, they then move on to the 4th hour charge, which is for the period of 4 hours parking, not 3 hours and 1 hour. So that is working quite well at the moment, and I have to say our car parks are still reasonably well attended, so that's, I'm hoping, very good for our high streets, or was up until tomorrow. All aspects of cleansing are running. Our environmental enforcement was back up. There will be an impact, obviously, for the next month on our NES trial, so we'll have to have a conversation with those, and again I'll update you at the next meeting. Obviously there's been a lot of changes since I was starting to put this together. Grounds maintenance will continue. We won't be pausing that this time. That outdoor work can continue, and engineers will make sure everything is safe. As I've said to you previously, we didn't see much of an impact on our cemeteries, but again, we have a plan in place if we are to get any increase to that, but they will continue operating as normal, and as ever, keeping our trucks on the road, our contractor in terms of our workshop maintenance for our vehicles and for testing of taxi vehicles to keep them operational, has worked throughout and will continue to work throughout. And I've mentioned the Barley Lands Recycling Centre, and we will also, of course, be doing works in terms of arboriculture. Again, outside work can carry on. In terms of environmental health, not a lot has changed from my last update. These are kind of current figures. It was only a short time ago. I have to say that the majority of work in relation to COVID is falling onto our environmental health service at the moment, and that's around support for business, inspection, enforcement, etc. So I will try and get you a much better update for next time round, but our environmental colleagues are very busy reading regulations, because as of tomorrow they will be providing advice and guidance on them. So they've had just over 24 hours now, I think, to really get to grips with the regulations as to how they're going to advise our businesses and public. So apologies that that's not a full update, but I just wanted to make sure you're aware they are under pressure at this moment. Towngate Theatre, the good news is we have from the government via the Arts Council got a arts recovery fund sum of £279,000. That is to support the theatre between October and March. So we were very pleased to get that, one of many across the country and in the region. But sadly, of course, the theatre will close as of tonight. We have closed the cafe as well, because the town centre will obviously be quiet for the next month. So we have ceased that service. As I've said earlier, our leisure centres will close again as of tonight and will run to minimum staff. So we will keep our fingers crossed that they can come back and be open. What I can say to members, in the period that they were reopened, they were exceeding the expectation that they thought we thought that they would get, and that was increasing and starting to look like we were going to be able to, at some point in the near future, be able to get to some sort of normal business. So it is a shame that we've at this point that those buildings have had to close. Our parks and countryside quite clearly have been very, very, very busy. We have had lots of comments from members of the public of places they've never been in our borough and how nice they are, which is very nice to hear. But sadly, again, we're just getting sport back, and now we've got to stop sport on the pitches, and they again will not be available for play from tomorrow. Our community facilities have been a significant challenge for us and for those that lease buildings from us. It is very difficult to open buildings for all sorts of reasons around ventilation, etc. Where there's physical activity happening, there does need to be ventilation when they are open for seated like bridge or whist or whatever people may be playing in community centres, but that would necessitate a window being open, which I stood outside for half hour today. It was a bit nippy, and I thought, well, I couldn't sit with my window open in this for more than 10 minutes. So it is a real challenge for community centres, and unfortunately the Lady Community Association could no longer sustain the building with their finances, and we've been working very closely with them and the activity centre there, and we will look, we have now taken possession of the building after the association handed the keys back on Friday. Just to reassure members, we are now working on the building to see what needs to be done to get ready to reopen, and our intention is to reopen and then work out what we are doing in the future with the building, as it is in poor condition. But that is something that we'll be dealing with in reports to various committees over the next few months. But it's the Community Association have been there for 27 years and have done a good job of keeping the building open, and is our most popular activity centre, but it really has impacted significantly with such a large building and such large costs. So but we'll hopefully be able to bring the centre back when it is safe to do so, and once we have fully assessed the building. So that's the update from me, Councillor. Happy to take any questions. Obviously, anything on latest regulations, you might have to wait while I have a quick look through them because I'm catching up with them myself. So apologies if I stumble over an answer on these ones.
Thank you, Paul. Can I just say at this point in time, I think this committee would give our thanks unanimously to not only yourself, but your staff on the environmental health side, Rachel Glover in particular, and others. I know the amount of work that's been going on in the background right across the borough, meetings with various high street, Billericay, Basildon and Wickford High Street, traders, etc. And it's been a big task, and I think it's been performed magnificently across this borough. And please convey our thanks to all of the staff, but that also goes down to the refuse collectors, everybody. This side of the house has got a lot of work that's had to carry on, and I think everyone's been fantastic. On the Langdon Community Centre, I should add to what Paul has said, I did have discussions last week with the one active trustee of the 3 trustees on what was going on on the Langdon Community Centre, and I did assure him that Langdon Community Centre, we weren't abandoning the community association whatsoever, and the building we would try to reopen any bits we could. This was prior to what happens tonight. We were looking to see if we could reopen any areas of it, but a lot of work is needed to be done on the building, and the community association financially were not able to run the building. Councillor Burton Sampson.
Yeah, thank you, Chair. And you know, you've stolen a bit of my thunder there, because I would like to say a massive thank you as well to the work that Paul and the rest of his team have been doing, because it's absolutely outstanding. You know, these are tough times, and the way they're adapting and quickly adapting to changing rules and regulations and making us all safe whilst keeping the borough running is just outstanding. So, you know, I'm in awe of you guys and what you're doing. So thank you, and please keep that up. And, you know, it is sad news about the Langdon Community Association as well. I've met them a number of times, and I think I'd like to take this opportunity again to thank them for the work they did for the community whilst looking after that centre, because I know that centre is a great resource for people in the community, and I know that we will do the right thing as we move forward in finding a solution. So thank you to the Community Association too. I just, if I may, Chair, just one quick point of clarification, and I think I know the answer. In your update, Paul, you mentioned that the centres have to close again tomorrow, apart from those delivering preschools. I'm guessing that doesn't impact food banks neither. So will the food bank still be okay to operate from Pitsea and any other sites where we've got food banks operating?
There are some subtle changes in the regs, so do apologies. Yes, food banks can still continue. There are some support groups that can continue. So we're just the nuances of the new regulations we're just going through as officers at the moment, so that we can give solid advice to everybody. So Councillor Harrison has already emailed me about something not related to that, but when are we going to get the press out? Well, we are absolutely going to get the communication out, but what we do not want to do is get that comms wrong. So we want to make sure we're all agreed, but we'll be very clear with everybody, as we will with our tenants, leaseholders, our hirers, of what can continue and definitely what cannot continue.
Thank you, Paul. Malcolm.
Yeah, thank you, Chairman. As Councillor Burton Sampson knows, I did have an amendment for one of the motions at Council last week, which unfortunately we didn't get to. And that was actually designed to extend the thanks from the Breast Cancer Unit to a whole range of key workers, but particularly including our own staff, like the refuse collectors and all those sorts of key services that we depend on. So I'll join with you in acknowledging the work that's done, much more, if you like, by the front line of the council, perhaps, than the management in that context. I did, though, just want to pose a question about Langdon Community Centre, because if my memory serves me right, it was opened as a new centre during the period whilst I was a member in the late 80s, early 90s. And if it needs such major investment that one of the serious options being considered is to demolish and rebuild, which the leader has certainly implied in some of his comments, I have a question about the standard of building on these. And then, if you like, you can link that across to the youth zone, where we're granting 125-year lease. This has only lasted about 20% of that time. And it just worries me to commit to 125 years on a building, irrespective of its use, when some of our other public buildings are only lasting just over 25 years. So I don't know whether Mr. Brace can make any observation on that.
I think the 125 years on the youth zone is the lease for the land, isn't it? Not the length.
It is the lease, but you know, there will be a building on that land which will be a public building. And I would put it to you, and it's one of the issues I've had with developments in the borough generally, is a lot of the modern methods of construction do not have the longevity of traditional methods of construction. And whilst some of them, like timber frame, are now more proven, you know the problems that we've had with Cypher-X, Five Links, Castles Estate. The list is as long as your arm, and you know that as well as I do, that a lot of it is because the construction was not sound to last its expected lifetime.
Mr. Brace, do you want to come back?
Yeah, I'll clarify that. And yes, onside, absolutely agree with you, Councillor Buckley. They will be the owners of the building. We will be leasing the land. It will be their building. And in the period of 125 years, they will be obligated by the lease to rebuild that building at least twice. So it will not be the same building because, quite frankly, you know, young people might want something different in 25 years. Who knows? It will be a very different world 25 years after that. So you end up with a building that is not fit for purpose. Now we go back to Langdon, 29 years, I think, since it was built. It's now not fit for purpose. It's of its time. Its construction is of its time. It's very hard to adapt it to what it does. It match what the needs are in Langdon? We're not sure it does. It's very expensive to heat. It's very expensive to maintain, but it is very well used. And the leader and I met with a few of the chairman of the activity centre there, just for them to get reassurance that it would still to be able to continue. And you know, there's over 1,000 members going there every week, so it's very important that these things continue. So we gave that assurance that it is. What the future is, I'm certainly not. I can't look into a crystal ball and see what that is. But what I can absolutely say is that the building is going to be a challenge. We're going to have an assessment of that. We'll know what state it's in and what we can do. And then after that, as I said, reports will go to committee around what is the right thing to do. Wickford Community Centre, the similar thing that we've done to Wickford Community Centre, is an option for Langdon. But at this stage, you know, it is an option. There may be other options which we've not explored as yet, because obviously this has been a very fast moving, something fast moving that's taken up quite a bit of officer time in the last week or so. I haven't really had let's look to the future and what exactly we're going to do kind of thoughts yet. But certainly we're dealing with the building first and foremost and the community association. Then we'll start looking to the future. But most importantly, as I've said to many members and certainly to the community association, we will be involving the Langdon community in what that future will be. This is not just a, you know, build it and disappear. This is we've got to work out exactly what is needed in Langdon and then work out how we can deliver it.
Thank you, Paul. Just for noting, unless any other member wants to raise anything on there, but thanks for that report, Paul. I think it's most useful.
Sorry for its lateness, Chair. It's just been a bit hectic this week, so apologies.
Yeah, not a problem. Not a problem. Okay, that's for noting. Item 11 is the South Essex Parking Partnership Joint Committee. That's the joint meeting, which I go as the council's rep. I think it's important that the minutes are open to people. And can I just add that SEP have notified today that they're going to continue operations in enforcement over the next month. So you know. Okay. I think that's all for tonight. Everyone's looking around. I haven't missed anything, have I? But I just shows you how important it was. We put this additional meeting in because it's been a good meeting. We've had the health provision update, which I think was useful, and that was something which was needed. And now we look forward to the next one on the 25th of November. So thanks very much for your attendance. Absolutely good meeting. Well done, all of you. Thank you.